Question came in, what causes my plantar fasciitis? Why do I have this inflammation developing in my heel? So there's 4 common reasons, and there's a 5th one that we kind of throw in sometimes depending on how things look on the x-rays. But number 1 is a recent weight gain. A recent weight gain can definitely contribute to increased inflammation over the heel. Number 2, a lot of concrete or pavement. Concrete and pavement just in most everyday workplaces, that's just common. Number 3, the old or poor fitting or the wrong kinds of shoes. There's lots of different types of things that can happen with shoe gear that can contribute to inflammation. What's really popular during the summer months is flip-flops, sandals. These types of shoes many times don't have a good midsole to them, so that can contribute to inflammation as well. The 4th reason is trauma of some kind. That's kind of the wild card. Trauma could include just getting onto a treadmill and walking 10 miles and you're not used to doing that. We have a New Year's resolution in January and you decide to go to the gym, and many times patients get onto that treadmill and they try to make up for lost time. Doing things like a stationary bike, swimming pool, rowing machine, that's going to be heads and tails better while you're having that inflammation in your heel to try and get through that. Don't worry, don't get me wrong, I want you to be active. The wild card one, the one that depending on how things look on the x-rays, is really your foot type. If you have an excessively low arch or excessively high arch, then that can also contribute to increased pressure over the heel area. Right there is commonly where that inflammation will start developing. Just by way of information, plantar fasciitis, or the inflammation in that heel, occurs from repetitive trauma to that area, again, based upon those 5 things I talked with you about. Plantar fasciitis, the plantar fascia is a ligament that extends from this heel all the way up to the bones up here, and when it's inflamed, it's called plantar fasciitis. Another name for it is heel spur syndrome. So that plantar fascia, when it gets inflamed, it can cause a reaction around the heel bone, and it causes the bone to start laying down across that plantar fascia. It looks like on an x-ray a heel spur. And so the spur isn't though what's causing your pain, it's actually inflammation that's causing the spur to form. So that is the first part of plantar fasciitis. We'll talk more next time about the treatments for plantar fasciitis.